day, ma'am. We're group 3. We're going to present physiologic changes in aging affecting integumentary system, musculoskeletal system, respiratory system, cardiovascular system, hematopoietic, and lymphatic system. I'm Rika Bigil Yasa, leader of Group 3, and my group members are Agaton, Andres, Calina, Dela Vega, Fabia, Medina, Palicpic, Salandanan, and Sarong. First presenter will be Agaton and Palicpic.
For the integumentary system, it consists of the body's outer layer. This include the following: the epidermis, the outermost layer; the dermis, the inner layer of the two main layers of the skin; hypodermis, the bottom layer; associated glands, hair, and nails. These act as barriers within the external and internal forces. Next.
Aging is a natural process of the body under the influence of time and the environment. As we grow older, we experience changes in our skin like wrinkles, sagging skin, and such. Our skin changes in ways that can make it more prone to different types of diseases. Aging causes the integumentary system by causing it to be thinner, more translucent, frequent skin injuries, tearing, and infections. Changes in the connective tissue reduce the skin strength and elasticity, which is known as elastosis. Next system.
Next is musculoskeletal system. So the musculoskeletal system or locomotor system is a human body system that provides our body with movement, stability, shape, and support. Musculoskeletal system is divided into two broad systems, the muscular system and skeletal system.
So people begin losing bone mass or volume as they enter the later stages of life. This is especially true for women after menopause. This deterioration in bone density can be attributed to calcium loss, among many other minerals. This is largely known by everyone as naturally occurring pathophysiological change to the body in relation to aging. Like our bones, muscles also begin to lose their size and strength due to old age. We can accredit age-related changes like weakness, fatigue, and even reduced tolerance to physical activities like exercise. Such decline in muscle functionality is caused by muscle fibers reducing in number, shrinkage in size, or muscle tissues being replaced a lot more slowly. Additionally, our joints are also largely affected by aging because they become less flexible and stiffer due to loss of pre-existing fluids in the joints. This leads to an increase of friction between the cartilages. Next system, please.
Let's now move on to the physiologic changes in aging affecting the respiratory system. So the respiratory system is the one system that seems to be the ablest to compensate for the functional changes of aging. The lungs are the centerpiece of our respiratory system. And aside from the lungs, it also includes the trachea, which is also known as windpipe, chest wall and diaphragm muscles, blood vessels, and other tissues. And all of these parts make breathing and gas exchange possible. So the lungs serve as two primary purposes. The first is to allow the body to absorb oxygen from the air, and the other one is to get carbon dioxide out of the body. We need oxygen for the body to function correctly, and our body utilizes it to fuel our body's functions, and when it does so, it releases carbon dioxide gas as a waste product. Next, please.
So the lung tissue, muscles, and bones undergo changes as people age, impacting breathing. So the lungs' entire capacity, or how much air they can carry, is around 6 liters. It roughly equates to 3 large Coke bottles. By the age of 20 to 25, the lungs are fully developed. And after age 35, their functionality starts to deteriorate as people age, which might gradually cause breathing to get harder over time. Next.
The following are the several changes that could reduce lung capacity as people age. Number 1, the air sacs get boggy and lose their structure as we age. Near the airways, muscles and other tissues may lose their ability to keep the airways completely open. The air sacs may lose their firmness and shape. Therefore, less space is available inside of them as they become thinner. Second, The diaphragm may deteriorate and lose its ability to support breathing in and out. The diaphragm can weaken over time, which makes it harder to inhale and exhale, and only when you exercise will you notice a difference. Next, please.
So the rib cage is altered so that it can no longer expand and contract with breathing due to the rib cage bones thinning and changing in shape. So older ribs are more elongated and have a flatter overall curvature than younger ribs, which is the main way that the age affects rib shape. And also that the cough-inducing airway nerves become less responsive to foreign particles. The lung tissue may become harmed when particles accumulate in the lungs. And large numbers of particles such as smoke or bacteria may build in the lungs and cause issues as the nerves that generate coughing in the elderly become less sensitive. And number five, a person may experience immune system deterioration as they age, making them more susceptible to illnesses like pneumonia and flu.
The cardiovascular system, it is a closed circulatory system seen in the humans and other vertebrates. Its components include the heart, blood vessels, and blood. The heart has chambers such as the four heart chambers, including two atria and two ventricles. Um, the most common aging changes in increase of stiffness of the large arteries or hardening of it, also called as arteriosclerosis, which causes elder people to experience such as high blood pressure or hypertension and can possibly result in heart disease. A major cause of heart disease is the fatty deposits that are building up the walls of artery as the time goes by, which causes a limit of oxygen-rich blood flow to the organs. Next, please.
So other factors of how aging can cause other changes to the heart. The first one is the valves that serves as a door-like parts that control blood flow may become thicker and stiffer. So stiffer valves can limit the flow of blood out of the heart and become leaky, both of which can cause fluid to build up in the lungs or in the body, such as the legs, feet, and abdomen. Next is the chamber of your heart may increase its size. The heart wall thickens, so the amount of blood that a chamber can hold may decrease despite the increased overall heart size. The heart may feel more slowly. Next is long-standing hypertension is the main cause of increased thickness of the heart, which can increase the risk of atrial fibrillation, a common heart rhythm problem in older people. Lastly, people become more sensitive to salt, which may cause an increase in blood pressure and or an ankle or foot swelling, also known as edema. The next part is there are ways to how to prevent heart disease. First, be physically active. If possible, aim to get at least 150 minutes of physical activity each week. Every day is the best. If you smoke, quit smoking. Smoking adds to the damage of artery walls. We think even in later life can lower your risk of heart disease, stroke, and cancer over time. Next, prepare a heart-healthy diet. Choose foods that are low in trans and saturated fats, added sugars, and salt. As we get older, we become more sensitive to salt, which can cause swelling in the legs and feet. Eat plenty of fruits and vegetables and foods high in fiber, like those made from whole grains. Next, avoid binge eating, keep a healthy weight. Next, drink alcohol moderately. Men should not have more than 2 drinks a day and women only one. Then lastly is manage stress. Learn how to manage stress, relax, and cope with problems to improve physical and emotional health. To avoid this to happen, there are interventions such as healthy diet, exercise, slow the rate of aging of the heart and arteries. Next.
Hematopoietic system. Hematopoietic system consists of organs and tissues, primarily the bone marrow, spleen, tonsil, and lymph nodes involved in the production of blood. Aging is universally phenomenon that affects all normal cells, organ system, and organism. Accordingly, the bone marrow undergoes changes with age. Hematopoietic system suffers the consequences of aging manifested by the emergence of chronic anemia, immune dysfunction, increased incidence of myeloproliferative syndrome, and overt chronic and acute myeloid malignancies. Aging hematopoietic stem cells ensure a balanced production of all blood cells throughout the life. As they age, HSCs gradually lose their self-renewal and regenerative potential, whereas the occurrence of cellular derailment strongly increases. Until puberty, the entire skeleton remains hematopoietically active by age of 18. Only the vertebrae, ribs, sternum, skull, pelvis, proximal epiphyseal regions of humerus, and femur remain active sites of blood production, with other medullary sites infiltrated with fatty tissue. By the age of 40, the marrow in sternum, ribs, pelvis, and vertebrae is composed of equal amounts of hematopoietic tissue and fat and cellularly declines gradually thereafter. By the age of 65, bone marrow cellularity has been estimated to be approximately 30% with a corresponding increase in marrow fat.
For lymphatic system, the lymphatic vascular system functions to regulate tissue, fluid transport, and facilitate macromolecular absorption. Lymphatic vessels are also key routes for the trafficking of immune cells from tissues to lymph nodes during immune responses. The aging process induces changes in structure and function of lymphatic networks. Aging associated with alterations in lymphatic contractility, decreased pump efficiency with result in excessive retention of fluid within interstitial spaces. Aging induced loss of endothelial glycolysis and production of inflammatory cytokines. Aging associated basal activation of mast cells delays immune response. That's all. Thank you.
That's all for our Group 3 that we tackle about physiologic changes in aging affecting integumentary system, musculoskeletal system, respiratory system, cardiovascular system, hematopoietic, and lymphatic system. Thank you.